When hair loss reaches an advanced stage, one question naturally arises. Is it still possible to achieve real, visible results? Today, we bring you not one, but two truly inspiring hair transformation stories that stand as powerful examples of courage, patience, and complete transformation. These journeys prove that even at advanced stages, the right approach can restore more than just hair. It can restore confidence. If you are ready to transform your look and regain your confidence, then visit QHT Clinic, which is now in Haridwar, Delhi, Gurugram, and Hyderabad. Book your consultation today and take the first step toward your own stunning transformation. Let us move on to the pre-treatment conditions of both patients, where our experts carefully analyzed and identified the extent of their baldness. Patient 1 was experiencing diffuse grade 5A baldness. His hairline had significantly receded, and the side areas had become extremely thin. Only a few follicles were visible in the frontal tuft region. His frontal area was almost completely damaged, and the mid-scalp had undergone severe thinning, which greatly affected his overall facial balance. Fortunately, his donor area was strong and healthy. This played a crucial role in the success of his procedure, as it allowed for precise graft extraction and strategic placement. Because of this strong donor region, our experts were able to achieve dense, natural, and highly impressive results. Patient 2 was struggling with diffuse grade 6 baldness. His hairline had completely receded, and the frontal, mid-scalp, and crown areas were entirely damaged, which had a significant impact on his facial frame. Despite the advanced stage of hair loss, certain areas of the scalp still contained healthy hair follicles, providing a solid foundation for treatment. Once again, a strong and dense donor area proved to be the key advantage. These healthy grafts became the backbone of his transformation journey, contributing significantly to the final outcome. Both patients faced different grades of baldness, yet shared one powerful advantage: a strong donor area. This became the foundation of their remarkable transformations. Now let us move forward and see how our experts meticulously designed their perfect, natural-looking hairlines to restore confidence and facial balance. If you are facing similar hair problems, share your scalp pictures with our experts on the given helpline number. They will guide you on whether you need a hair transplant or a medication plan. Why is hairline design one of the most important steps in a hair transplant procedure? Hairline design plays a crucial role because it defines the overall facial appearance. A well-designed hairline restores not just hair, but facial balance, symmetry, and confidence. Even with excellent graft quality, an incorrect hairline can look unnatural. This is why hairline designing requires experience, precision, and a strong aesthetic sense. After a detailed examination of the complete scalp, our experts begin by trimming the hair and giving each patient a proper head wash. This helps remove dirt, excess oil, and dead skin cells, creating a clean and smooth surface for accurate and precise markings. While designing the hairline, our specialists carefully evaluate facial proportions, bone structure, and the level and pattern of baldness. For patient 1, our experts created a custom-shaped hairline tailored to his facial structure. The distance of the new hairline was carefully measured from the glabella point to ensure perfect facial symmetry. Along with the hairline, all remaining affected areas that required coverage were also clearly marked. For patient 2, the hairline was again measured from the glabella point. However, since he was suffering from diffuse grade 6 advanced stage of baldness, full scalp coverage was required. In his case, our experts first designed a customized hairline and then marked the frontal area, mid-scalp, and crown to ensure complete and balanced coverage. These markings were not simply lines drawn on the scalp. They served as the foundation of the entire procedure. They guided the surgical team, defined the recipient zones, and ensured that every graft was placed with accuracy, resulting in a natural, balanced, and aesthetically pleasing outcome from every angle. Want a perfectly natural hairline that suits your face? So book your appointment with our experts today and start your transformation. After completing the hairline designing, our experts move on to the next critical phase of the. Once the markings are finalized, the slit creation process begins, which is one of the most crucial steps in a hair transplant. Within the pre-marked recipient zones, our surgeons carefully create tiny, precise slits. These slits determine the exact direction, angle, depth, and density of each graft, playing a vital role in achieving a natural outcome. For both patients, an advanced zigzag technique was used in the hairline area to create a soft, natural, and seamless appearance. This step forms the true foundation of a successful hair transplant. After the slits were completed, our experts began the graft extraction and implantation process, carefully following the direction and angulation that were created earlier. Now let us understand the graft procedure for each patient, one by one. For patient 1, our experts implanted single and fine hair follicles in a natural zigzag pattern to create a soft and realistic hairline. This technique helped restore his complete facial frame and ensured a seamless transition between the hairline and existing hair. In the frontal and mid-scalp areas, double and triple hair follicles were implanted to achieve optimal volume and density. In total, 3,100 grafts were implanted, all carefully extracted from the safe donor zone, ensuring healthy and long-lasting results. Patient 2 presented with a more advanced stage of baldness compared to patient 1. To maintain a natural and soft appearance, our experts first implanted single and thin follicles in the hairline zone. Following this, double and triple follicles were implanted in the frontal and mid-scalp regions to enhance density and coverage. In the crown area, special attention was given to recreating the natural swirl pattern. Here, single, double, and triple hair follicles were implanted at varying angles to ensure a realistic and natural crown appearance. In this case, a total of 5,200 grafts were extracted from both the donor scalp and beard area, allowing for comprehensive coverage and balanced density. These transplanted follicles are naturally resistant to DHT, which helps ensure long-lasting, stable, and completely natural-looking results. 1 month after the transplant, the patient visited our clinic for his first follow-up PRP session. At this stage, our experts observed approximately 40% shedding, which is a completely normal and expected phase of the hair transplant process. At the same time, the donor area was fully healed, with no visible signs of discomfort or damage, as clearly seen on the scalp. Three months after the transplant, the patient had completely passed the shedding phase. The hairline had begun to take on a natural shape, while the native hair continued to grow normally alongside the transplanted hair. The donor area was fully healed, with no visible signs of extraction. Overall, this stage clearly indicated a smooth, healthy, and successful recovery, setting the foundation for excellent upcoming results. 9 months after the transplant, Patient 1 achieved remarkable and life-changing results. When compared to his pre-transplant condition, the transformation is clearly visible. His hairline now forms a sharp yet natural frame for the face, while the frontal and mid-scalp areas display impressive volume and density. Overall, his appearance has completely changed. The patient can now cut and style his hair freely according to his preference, and the transplanted hair blends seamlessly with his natural hair, delivering results that look and feel completely natural. You can begin your own hair restoration journey by simply giving us a call or sharing your pictures with us. Our specialists will carefully assess your condition and guide you toward the most suitable treatment option based on your individual needs. Now let's move on to the follow-ups and results of patient 2. But we look at the follow-up photographs that the patient personally shared with us after the surgery. These images are from day 1 through day 5, allowing you to clearly observe the step-by-step progress during the initial recovery phase and understand how the scalp heals in the early days after the transplant. 1 month after the hair transplant, approximately 60% shedding was visible on the scalp. This is a completely normal and expected phase of the hair transplant process. At the same time, the patient's native hair had already begun to grow. Six months after the transplant, the improvement in patient 2's scalp was clearly visible. His hairline had begun to take a perfect shape, beautifully framing his face and enhancing his overall appearance. Visible growth was observed in the frontal and mid-scalp areas, where the native hair had started merging seamlessly with the transplanted follicles, as clearly seen on the scalp. Even though this was only the 6-month milestone, the results were already quite impressive, and the patient was clearly on track for an even better transformation ahead. Eight months after the transplant, the patient achieved complete and mature results, which are scientifically considered the ideal time frame for full hair transplant transformation. When comparing his before and after conditions, the difference is dramatic and highly noticeable. His hairline is now perfectly framed. The frontal and mid-scalp areas have gained excellent volume and density, and the crown area has achieved a natural swirl pattern. As a result, the patient's overall appearance has completely transformed, which is clearly visible on his scalp. At this stage, the patient can cut, style, and manage his hair freely, exactly the way he desires, just like natural hair. If you're also facing similar challenges, then right now, share your scalp picture with our experts, and they'll guide you on what works best for you. Can a hair transplant give results even in advanced baldness? Yes. Even in advanced stages of hair loss, visible and natural results are possible if the donor area is strong and the procedure is planned correctly. Customized hairline design, proper graft distribution, and advanced techniques play a crucial role in achieving successful outcomes. 2. What is diffuse baldness, and how is it different from regular hair loss? Diffuse baldness involves thinning across the scalp rather than complete bald patches. Hair follicles are present but weakened. With proper evaluation, many diffuse cases can be successfully treated using hair transplantation or a combination of medical therapies. 3. Why is a strong donor area so important for a hair transplant? The donor area provides healthy, DHT-resistant hair follicles. A strong donor region allows for safe graft extraction and strategic implantation, which directly impacts density, coverage, and long-term results. 4. What is slit creation, and why is it important? Slit creation involves making tiny incisions in the recipient area where grafts will be placed. These slits determine the direction, angle, depth, and density of hair growth, making this step essential for achieving natural and long-lasting results. This was the complete transformation of our 2 patients. We hope you found their journeys inspiring, because turning a bald look into a bold look is never easy. It requires expert planning, advanced technology, and most importantly, the patient's trust. If you also want to transform your appearance completely, don't wait. Book your consultation with our experts today and begin your journey towards a new, confident you.
Hello friends, if you have not subscribed to our channel yet, please like this video, share and subscribe to our channel, and don't forget to hit the bell icon so that you will get update on every video.